Okay, so this Science of Sport video focuses on BTEC Sport and Exercise Science, Unit 2 Functional Anatomy, and in particular D1 Anatomy of a Bone. This is the second video, so this is part 2 and specifically looks at bony landmarks. Now the first video looked at the anatomy of a long bone, and this video is focusing on the bony landmarks that you may need to be able to describe or recognise in a diagram or in an exam question. So I'd like to show you a couple of short video clips that incorporate, you can see on the screen already, other bony landmarks that you don't need to know, and hopefully the video clips will just focus and play through the bits that you do need to know.
Our next term is going to be called a fossa. A fossa is a basin-like depression that is often the surface for articulation of a joint, but we see them in many areas of the body, and the example I'll show you on here is on the internal surface of the skull. It's going to be called the posterior cranial fossa, so I'm just highlighting it here, and if I just shade in, we can see that it's a depression. So it's on the internal surface of the skull, but it's towards the back or dorsal side of the body. So posterior cranial fossa. So we'll just make a note of that down here as well, that it's often a site of articulation of joints. So just writing that down here. And we'll move on to the next bone marking. So brachial artery and radial nerve are going to run through there. The next structure is called a notch. A notch is going to be a structure that is similar to a fossa, but located on the edge of a structure. If we have a look down here on the proximal end of the ulna, we can see the trochlear notch. I'm just shading it in here. Once again, this type of bone marking, as with many of our depressions, is going to be a site of articulation. So we've got our trochlear notch there. Hi guys, today we are going to be talking about bone markings again, with a focus on the markings that aid in the formation of a joint. In the last video, we described that bone markings refer to common features or specific uses that structures on bones have, and that they were referred to as a bone marking. So let's get started right away here. The focus of this lesson will be the bone markings related to joint formation. And the first bone marking we're going to take a look at is called a condyle. Now an epicondyle is involved in muscle and ligament attachment, but a condyle itself is a rounded articular projection, and we'll have a look at that here on the skull. So if it's a bone projection that's going to be involved in articulation, it's often going to have hyaline cartilage over it. So we're just outlining this occipital condyle here. So it's a condyle and it's on the occipital bone of the skull, and it's going to be involved in articulation with the most superior vertebrae. In this video we are going to focus on bone markings. If you look at the bones that I have on the screen here, we can see that there is a pelvis, which is comprised of several different structures, and a vertebrae, which has a very distinct shape. The appearance of these distinct shapes requires specific naming, not just for the bone, but for the common features. What we'll focus on over the next few videos is naming these common features and describing what they mean. So this video now will focus on bone projections that act as attachment points specifically for muscle and ligament. Ischial, just the abbreviation of ischium, and then our bone marking name, so spine. Tuberosity is a little bit different. A tuberosity is a large and round projection, and it's often quite roughened. So if we look on the bottom of the ischium again over here, we can see this ischial tuberosity here is quite a rough surface, and it's very large as well. So that again is just going to be called the ischial tuberosity. So as we can see now, there's quite a common naming pattern that we're starting to use, and we can get a hang of how to use it properly and how to abbreviate bone names properly. The next one we're going to look at is called a process. A process will just be any prominence of bone on the body. So if you look down here at the vertebra, I'm just outlining this process here that's pushing directly out from the vertebra. And that's going to be called your spinous process.
So those couple of very short video clips try to give you a visual sense of these bony landmarks. They literally are like a map of the bones. They are specific characteristics or specific features that enable us to identify places on a bone, and they have different functions. What I've tried to just do is group them. So we've got the red depression, so the notches and fossas in a bone or on a bone are depressions, dips, if you like. Fossa is a shallow depression. Notch is a V-shaped depression. And I've just put S and F where I've tried to separate the structure and the function. So a notch is structures as a V-shaped depression, and its function is to stabilize another bone which slides in and out of the notch. It sort of guides the other bone's route when there's movement. Similarly, a fossa is a shallow depression on the surface of a bone, and its function is to receive another articulating bone. So it's almost part of a joint. Okay, then I've grouped also in blue here the projections, the lumpy, the sticky outy bits, so the condyles, tuberosities or processes. So what you're going to need to do is find a way of remembering not only what each of these bony landmarks mean, i.e. what they do, how they're structured, and maybe even an example, and you need to find very clever ways to do that. So finally then, again, just to give you a sense of a potential exam question on this topic of bony landmarks, here's one. It's for 2 marks, and it says, it gives you a bit of context. So often the examiner will give you a sentence or so that sets the scene. So a tuberosity is an example of a bony landmark. That's a statement. And then they follow up with the next sentence asking you to describe the function of a tuberosity. So 2 marks to give the function of a tuberosity. So here are some student answers. Again, pause the video and do your best to have a read through these. They got different marks. This got 2 marks on this left-hand side here, so this fulfilled what the examiner wanted it to do. And you can see that it's actually a very concise answer. The tuberosity is a large rounded bump or prominence. Brilliant concise sentence, that's 1 mark, which creates an area for muscle attachment. Perfect, 2 marks. And you can see how the mark scheme on the right over here does exactly that. It asked for providing a site for attachment, that's the function 1, and it's a raised bump ridge or bone protrusion. Truthfully, that's structure, but they've incorporated it into the description of what it is and what it does.